Hello and welcome to Vance and Lee's Lab.
Oski Jam.
Dennis, so we're doing injections 10. Dennis Zotnicki is a 59-year-old male who has been admitted with congestive heart failure and diabetes mellitus.
We just did this one.
No, you didn't. Injections.
Oh, you're right. He's the same dude.
Yeah, the same guy.
Did. We've done him twice.
Lee.
We gave him fluorescimide.
Sorry about my partner.
Fluorescimide.
His breakfast tray has not yet been ordered. Verify the orders in the MAR and administer the appropriate insulin injections. Document your care in the EHR.
Okay.
Maybe we won't take the computer this time. Let's go grab the stuff. Since that's like super easy.
Yeah, I agree.
We'll just keep it running though.
Yeah, that's fine. Because the nice thing is at times.
You actually can pause it.
Oh, okay. Let's do that. Not yet. Okay, so we're going to go ahead and open up the MAR or open up the EHR, and we're going to look in the provider orders and verify that Dennis Zotnik does need insulin, and he needs it now. And so we're going to go ahead and cross-check that with the MAR. And we look in the MAR, and in the MAR we see that he does need the insulin Gargine. It is a long-acting insulin, and he needs 100 units subcutaneously once a day, and he needs that at 9 a.m. So we need to administer that within 30 minutes of that time frame. With the dosage has been confirmed with his height, weight, age, and physical condition. The contraindications are going to be if he's already hypoglycemic, and we've checked his blood sugar, so he's good to go. And then if he has any diarrhea or infection or fever, then we need to be cautious before giving it to him. So we're going to go ahead and perform hand hygiene, squirt, squirt, and we're going to gather our supplies.
All right, we're going to go get them, so I'm going to pause you. We're back, and we've got the gear.
Okay, so we went ahead and got insulin, 100 unit syringe. We got our insulin gargling, and then we got some gauze, and we've got some alcohol swabs and our scanner. So we're going to go ahead and perform hand hygiene. Oh wait, we already did and collected our supplies. So we're going to look again at the MAR and make sure that this insulin is not expired and that it is for the right patient, right time, right dose, right route, and right drug. And we're going to calculate that this patient needs 100 units of insulin, which is in this 100 unit, or it's a 1 ml syringe. So we're going to administer 1 milliliter to him. So we're going to go ahead and prepare that now outside of the patient's room. So we're cleaning the top of the thing with the alcohol swab. And Vance, you can go ahead and do it.
Okay.
Here, I'll hold this up.
Oh, it's fine. I can hold up here.
No, because you're going to stab it.
Where's the alcohol swab?
I already cleaned it.
Oh, you already cleaned it? Oh, okay. Yeah. We're going to get 100 units, so we're going to draw up 100 units of air. Off the needle.
Yes. Hi.
We're going to draw up 100 units of insulin. Well, it draws up really slow since it's such a small needle.
Maybe not the blood transfusion.
It's coming.
Oh.
There we go. Alright, now we have 100 units of insulin. We're going to recap it. Alright.
Okay, so we are going to confirm that with another nurse. Hey Vance, we've got 100 units of insulin for whatever his name is, Zetnik.
Yep, Looks right to me.
Mr.
I'm
Zetnik.
gonna look at the MAR, make sure it says 100 units. Okay, yep, 100 units, and you have 100 units.
For Dennis. Okay. So because it's a high alert med, we need to confirm that with another nurse. So we're going to put this in our pocket and make sure we do not leave it unattended. And then we're going to enter the patient's room with our medication. So knock knock, hand hygiene. Hi Dennis, I'm Lee Short. I'm going to be your nurse today. I'm going to go ahead and administer your insulin that you're due for now. Can you verify your name and date of birth for me? Patient verifies his name and date of birth with 2 identifiers. So I need, we've already checked your blood sugars so that we know that you're not hypoglycemic, so we're good to give this. Do you have any diarrhea? Do you have any fever or infection? Okay, so we're good to go. And I just need you to tell me if you, I need you to let me know where you want this medication administered. We need to do it around the belly. We can do it on the back of the arm, but most commonly we do it on the belly, 1 inch away from the navel. So you want it?
Yeah, I said, all right, belly.
Okay, so the last time you had it over here, let's go ahead and alternate sides and do it on this side. We're going to verify with the scanner that we're going to scan the patient, and then we're going to go ahead and scan the drug.
Scan.
And it pulls up in the MAR that it's the right drug, right patient, right time, right dose, right route. We're doing it subcutaneously. And I just want to make sure that we're going to go ahead and apply gloves, and because we're going to be in contact with the patient. So I just want to make sure that you are in a comfortable position. Are you in a comfortable position? And we want to give you some privacy, so I'm going to make sure that this, I wonder if you can put, hold your computer.
Okay.
And put it underneath.
So there will be chairs in the line.
There we go. Oh, wow.
I didn't touch the screen.
You bended it. And
Yeah.
There we go. Now we're
If you touch the screen.
Yeah.
Okay, so I'm going to give you some privacy. I'm just going to lift up your gown right here.
Can I for the shot?
Yeah.
We need another alcohol.
So I'll have one right here.
Okay.
Here.
All right. You talk into it.
Okay. So clean injection site. Or first you're going to inspect for bruising.
Okay, I'm inspecting. Looks good.
Okay. Or inflammation or edema. Clean the site. Let it dry. And then it dries.
Okay, it's dry.
Insert at a 45 to 90 degree angle. Squeeze. Yep. Dart method.
Open it, spill it half away, and then you're gonna open this clamp, let that thing.
Good. And
Hold it for a little bit.
yeah, don't worry about it. She said it. And then take this gauze. Don't recap it. Do not recap it. You'll fail. Just put it straight in there.
Will you really?
Yes. Discard needle in appropriate place.
That'll be fine in the video. You will fail.
You will fail. Okay, go ahead and apply pressure for 1 minute. Yeah, see it removes gently. Apply pressure for 1 minute. Do not recap.
Wow.
Because it would show that it hasn't been used.
Oh, yeah. So we're good?
So,
all right, you comfortable?
Yep, so we're going to replace your gown and give you some privacy there.
Okay. Good.
Thank you so much. We're going to remove our gloves and perform hand hygiene, and then thank him and let him know he can reach the call light and document in the EHR.